Let's continue our discussion on diagnosis according to Zanko organ patterns with Lung Yang Deficiency. Lung Yang Deficiency is seen when the lung lacks the necessary activating heat to perform its activities and functions. It is a pattern that is not commonly described or listed in many textbooks, its symptoms and signs being attributed to the combined pattern of lung qi deficiency and kidney yang deficiency. Treating these two patterns simultaneously will also provide excellent results. Lung yang deficiency will arise from the same etiological factors that cause lung qi deficiency. Factors such as repeated inhalations of exogenous cold, overexertion, and consuming cooling foods will often be involved. Signs and symptoms: pensive fatigue, breathlessness, shallow breathing, slight cough, possibly with watery sputum. There will be edema in the face, arms, and hands. Frequent urination with copious amounts of pale urine, with cold limbs. The person is sensitive to cold and has an aversion to drafts. The person wears warmer clothes than is normal for the season or room temperature. There is weak voice, sunken chest or slump posture, reluctance to speak, pale lips, spontaneous sweating, frequent colds and respiratory infections, bright white complexion, pale or normal colored tongue with a wet coating. The front third of the tongue may be colored. There is a deep and weak pulse, especially in the right chin position. The key symptoms here are aversion to cold, fatigue, breathlessness, spontaneous sweating, and a pale and wet tongue. For the treatment principle, we tonify and warm Lung Yang. The acupuncture points we can choose from Lung 1, Lung 9, with 13, Do 4, Do 12, Bren 6, Bren 17, Kidney 3, and Kidney 7. We use the tonifying needling technique, and Moxa is recommended on Lung 9, Do 4, Do 12, and Kidney 3. To explain further on the choice of points, Lung 1, Lung 9, Do 12, UB13, tonify Lung Qi and Lung Yang. Kidney 3, Do 4, and Ren 6, tonify Yang in general. Ren 17 tonifies Zong Qi. Kidney 7 tonifies Yang, thereby helping to transform and transport fluids in the body. In addition to the advice that is relevant for lung qi deficiency, it is important that the person keeps warm, avoids consuming cold foods and drinks, both physically and energetically cold, and does not overexert. They will benefit from getting enough rest and drinking ginger tea. Lung Yang deficiency can be caused by kidney yang deficiency and lung qi deficiency, and in turn can result to kidney yang deficiency, phlegm pool in the lungs, damp phlegm in the lung, phlegm fluids in the lung. So to summarize, lung yang deficiency has its etiology and hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness weakening lung qi, repeated impairment of lung qi diffusing and descending function over a long time, spleen and kidney yang deficiency. Its signs and symptoms are shortness of breath, panting, which is worse on exertion, a forceless cough with a profuse watery sputum, a weak voice, a white bright complexion, a spontaneous daytime sweating, dislike of speaking, easily catches colds, tiredness, dislike of cold, feeling cold, cold hands, cold feeling of upper back, absence of thirst. The pulse is weak, especially on the right front position. The tongue is pale, slightly wet with white fur. For the treatment principle, warm and supplement Lung Yang. For the acupuncture treatment, we can use Lung 9, which supplements Lung Yang, Ren 6, which supplements the original Qi and fortifies Yang, Do 12 to relieve cough and dyspnea, Ren 12, which supplements Earth to strengthen metal, Bladder 20 supplements the spleen. Lung 7 promotes the descending of lung qi. Bladder 13 supplements lung qi. Stomach 36 supplements stomach and lung qi. Bladder 43 supplements the lung. And spleen 3, which is the source point of the spleen, or mineral with supplementation and large amounts of moxa. Thank you for your attention.